sleeve? I had no sleeves. So.
Today, I'll be performing a neurological assessment. I have introduced myself. I have identified my patient with 2 identifiers. I've performed hand hygiene, privacy. I have explained the procedure. My patient is oriented to person, place, time, day and date. Patient has abstract thinking is relevant. The attention span is accurate. Her comprehension is able to follow instructions. Her general knowledge is accurate. Her judgment is intact. Memory is intact. Vocabulary expected for age, education level. Her articulation, no problems with pronunciation. So first, we will be assessing cranial nerve 1, the olfactory. At the eye level, I'm going to have the patient occlude one nostril.
Close your eyes.
And close her eyes and smell. Can you identify what that is?
Coffee.
Okay. Occlude the other nostril.
Vanilla.
Okay. We're going to assess cranial optic nerve 2. There is a Snelling chart back here. She is 20 feet away. She's 14 inches. She's 20 feet away. At 14 inches, the patient reads the magazine. I'm going to have her read.
Patient correctly identifies scent presented to each nostril.
Okay. So she has read, so her vision is 20/20. Now I'm going to assess her visual fields using my ophthalmoscope to view the retina and optic disc, the red reflex. Okay, round red reflex is present. The optic disc is 1.5 millimeters. Her margins are round, well defined, creamy pink parlor. The cup of the retina is pink. I'm going to assess cranial nerve 3, the ocular motor, 4 and 6. So I'm going to inspect the margins of each eyelid. The eyelid covers about 2 millimeters of her iris. Okay, I'm going to assess the extraocular movement. So I'm going to have her eyes move in a smooth order.
I forgot one test.
I know.
Dang it.
Okay, the 6 cardinal fields. She had no EOM. I'm going to assess the papillary response to light, direct and indirect, and accommodation in both eyes. And see if they constrict. Look up and okay. Her pupils constrict bilaterally. I'm going to assess the cranial nerve 5 for the trigeminal. I'm going to ask my patient to clench her teeth and okay, clench them one more time. Okay, the temporal and masseter muscles contract bilaterally. I'm going to test the sensory function. I'm going to have my patient close her eyes, and I'm going to touch her with something dull, sharp, or soft, and have my patient tell me.
Sharp. Soft. Soft.
Oh.
Dull.
Okay. She is identified sharp, dull, and soft. I'm going to test the corneal reflex. As my patient looks up and away, I'm going to lightly touch the cornea with a fine wisp of cotton in both eyes. Okay, she blinks bilaterally. Okay. Now I'm going to test the cranial nerve 7, the facial motor functions. So I'm going to ask my patient to smile. Okay. I'm going to ask her to frown and wrinkle the forehead. Show teeth. Puff out your cheeks. Purse lips. Raise eyebrow. Close eyes tightly against resistance. The patient does all these things that are listed in a symmetric order. Okay, I'm going to test the cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus. So I'm going to ask my patient to say ah with my tongue depressor. Okay, the uvula is soft. The palate rise bilaterally and symmetrically. I'm going to test the gag reflex. The gag reflex is in place. I'm going to check my patient's ability to swallow. I'm going to have her swallow a sip of water. Okay. She swallows with no difficulty. No hoarseness is noted. I'm going to test the cranial nerve 11, the spinal accessory. I'm going to have her shrug her shoulders against resistance. Okay. There is a symmetric, strong contraction of the trapeze muscles. I'm going to ask my client to turn her head against resistance on the sternocleidomastoid muscle. Okay. There is a strong contraction of the sternocleidomastoid muscle on the side of the opposite head that she turns. Okay, I'm going to test the cranial nerve 12, the hypoglossal, to assess the strength and mobility of the tongue. Protrude the tongue and move the tongue to more side to side against resistance of the tongue depressor.
Stick your tongue out.
Oh.
I think you're supposed to touch it.
From side to side. Okay. And then with the tongue in the mouth. Okay, the tongue movement is symmetric and it's smooth bilaterally. I'm going to assess the condition of the movement of our muscles and the size, symmetry. The muscles are fully developed. They're symmetric in size. I'm going to assess the muscle strength and tone. I'm going to do the range of motion resistance, so relax the muscles. Relax the muscles, smooth resistance, and do like this. Out to the side. Okay, she has smooth range of motion. No involuntary muscle movement. She has no tics, tremors. Okay, I evaluated her gait and balance as she walked in. My client walked naturally across the room. The posture was good. The gait is steady, and she swung the arms opposite of each other. Now I'm going to ask my client to walk heel to toe. I'm going to make sure the client maintains balance. Okay. She walks on heels and toes with little difficulty. I'm going to now do the Romberg test. This is where she stands, she closes her eyes, and I would assist her, making sure she's not falling, for 20 seconds, and she does this with minimal swaying. Okay, I'm going to ask my client to stand on one foot and bend a knee. And on one foot she hops. Okay, now do the other. Okay. She does this without losing her balance. I'm going to ask my client to touch her finger to her nose and the other finger to the nose. Okay, she does this with little hesitation. I'm going to assess the rapid altering movements. My client sits. And I'm going to have her touch each finger to her thumb. The other one. She does this rapidly with speed. I'm going to ask her to turn her palms over. She does that rapidly. I'm going to perform the heel to shin test. Lie down in the side of the heel, down the shin, and the opposite leg. My client does this smoothly on each shin. Okay, now I'm going to use my tuning fork. And we're going to do the vibratory sensations. So I'm going to place the tuning fork on the distal radius. And I'm going to see if she can feel that. Can you feel it?
Yes.
Okay. And the tip of the great toe. Can you feel that?
Yes.
Okay. She can correctly identify the sensation. Okay. Now I'm going to have my patient close her eyes. Close her eyes. And I'm going to hold client's toes or finger on lateral sides and move up and down and repeat sides. And client correctly identifies the movements. Oh, yeah. Okay.
Up.
Just the finger.
Down. Up. 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 Down.
Okay. She correctly moves. Correctly identifies the movements. Okay, now I'm going to assess the tactile discrimination with fine touch. With the eyes closed, I'm going to use familiar objects and repeat with another object.
Okay, where's the point?
Okay. Can you tell me what's in your hand?
Coin.
Okay. Can you tell me what's in your hand?
Paperclip.
Okay. She correctly identifies the objects. Now I'm going to test the point location. I'm going to briefly touch my client and ask where I have touched her.
Go ahead and close my
Close your eyes.
Arm. Knee. Chest. Leg.
Okay. She correctly identifies. I'm going to test the gravithesia. With the blunt object, I'm going to trace a number on the palm of each hand and see if she can correctly identify.
5. 3.
Good job. I'm going to test the extension. Simultaneously, I'm going to touch the client in the same area on both sides of the body and ask for her to identify where I've touched.
Arm and leg.
Okay, she correctly identifies. Now I'm going to test my deep tendon reflexes. Okay, so first we're going to assess the bicep bender in the palm up hand. I'm going to strike the thumb pointed area, and it's a 2+, which would be a normal. I'm going to do the other side. 2+, it's normal. Okay, I'm going to assess the brachial radius reflex. Flex elbow, palm down. The rest or lap or abdominal flat side of hammer. I'm going to tap the radius, 2-inch wrist above radius. Okay. Okay. Now I'm going to test the tricep reflex with the arm hanging freely. The nurse supports the non-dominant hand elbow flexed, flat side. Tap the tendon above the blood something process. Okay. She is a 2+. I'm going to assess the patellar reflex. So with both legs hanging freely, I'm going to the flat side. I'm going to reflex. Okay, and the range is 2+, which is what we want. Now the Achilles tendon with the leg hanging freely, I'm going to tap on both sides. And it's a 2+ bilaterally. Okay, I'm going to assess the plantar reflex. With the end of the hammer, I'm going to stroke the aspect of the sole or the heel of the ball with the end and see the flexion of the toes. Okay. Flexion of the toes occur. I'm going to assess the abdominal reflex. So I'm going to lightly stroke both sides of that abdominal wall. And the muscles contract. The umbilicus deviates towards the side, being stimulated. And that concludes our thing.